You know that feeling when something's been bothering you for years, but nobody seems to have a real answer. That tightness in your chest when you check your blood pressure numbers. The worry that maybe you'll be taking these pills forever. I understand that concern because I've spent decades working alongside people just like you. I'm Dr. Naira, and after years helping older adults protect their heart health, I want to share something with you today. Something that might change how you think about high blood pressure entirely. So if you've got a few minutes, I'd love for you to stay with me. What I'm about to explain could make all the difference. Here's what usually happens at your appointment. The nurse wraps that cuff around your arm. The machine beeps. Your numbers pop up, 145/90. Your doctor looks concerned, adjusts your medication, and tells you to watch your salt, maybe suggests losing a few pounds. But here's what I need you to understand. Your blood pressure reading is like a warning light on your car dashboard. It tells you something's wrong, but it doesn't tell you what's wrong. And treating the warning light without fixing the engine, that's not really solving anything. Let me explain what I mean. When I talk with people about their arteries, I often think of garden hoses. When a hose is new and flexible, water flows through easily. But leave that hose out in the sun for years, and what happens? It gets stiff, brittle, cracks start forming. The water doesn't flow as smoothly anymore. Your arteries work the same way. Over time, especially past 50 or 60, they're supposed to stay flexible and responsive. But for many of us, they start changing in ways that create real problems. The inside of your arteries has this incredibly thin protective layer. Think of it like a nonstick coating in a pan. When it's intact, blood flows smoothly and your vessels stay healthy. But when that coating gets damaged, inflammation sets in. Cholesterol starts sticking. Your vessels lose their flexibility. And here's the part that frustrates me. The medications we typically use don't repair that coating. They manage the pressure, yes. They bring those numbers down. But the underlying damage, it's still there, quietly getting worse. Let me share something I've observed time and time again. A man comes in. Let's call him David. He's been taking his blood pressure medications faithfully for 8 years. His numbers look good, 128/82. His doctor's pleased. David feels fine. Then one morning, something happens. A heart event. Nothing massive, but enough to require intervention. And when we look closer at what's going on inside, we see arteries that are stiff, calcified, rigid. The medications controlled his numbers, but they didn't protect his vessels from ongoing damage. David's story isn't unique. It's actually quite common, and it taught me something important. We need to look beyond the numbers on the monitor. Your arteries have 3 layers. The innermost touches your blood directly. The middle layer is where flexibility comes from, filled with elastic fibers and smooth muscle. The outer layer holds everything together. When you're younger, that middle layer is like a well-maintained suspension system. It absorbs pressure when your heart beats, then gently releases it. This keeps your blood pressure steady and your organs protected. But as time passes, especially if you're dealing with inflammation, high blood sugar, or chronic stress, something happens. Calcium starts depositing in that middle layer. Not the calcium that belongs in your bones, but calcium that's wandered into places it shouldn't be. Those deposits make your arteries stiff. And when your arteries can't flex anymore, every heartbeat slams directly into your vessel walls. Your top number climbs. Your bottom number might actually drop. And that gap between them, that tells us your arteries have lost their spring. Most doctors focus on the individual numbers, but I've learned to pay attention to that gap, what we call pulse pressure. When it's wide, wider than 60 or so, it's telling us the vessels themselves are struggling. Now, you've probably been told to watch your salt, right? Cut back on sodium, and your blood pressure will improve. But for many people, that advice doesn't work as well as it should. And there's a reason why. Your kidneys are incredibly smart. They're supposed to balance sodium in your body automatically. Eat too much, they flush out the excess. Eat too little, they hold on to what you have. But there's something that can lock this system in place: insulin. When insulin levels stay elevated, which happens when we eat frequently or consume lots of refined carbohydrates, your kidneys get stuck in hold on to sodium mode. No matter how little salt you eat, your kidneys keep recycling it. Your blood volume stays high. Your pressure stays elevated. This is why some people can slash their sodium intake and barely see their numbers budge. The problem isn't just the salt, it's that their kidneys are locked in retention mode because of elevated insulin. And here's the thing most people don't realize. You can have normal blood sugar, but still have high insulin. Your body's working overtime to keep your sugar in check, pumping out more and more insulin to do it. That insulin is quietly raising your blood pressure, and most doctors never check for it. 4 ways to support your vessel health naturally. So what can you do about all this? I want to walk you through 4 approaches that address the root causes, not just the symptoms. 1. Protecting your vessel lining. Remember that protective coating I mentioned, the one inside your arteries? It gets damaged by blood sugar spikes and something called oxidative stress, which is basically cellular wear and tear. Every time your blood sugar shoots up after a meal, it chips away at that coating. So one of the most important things you can do is keep your blood sugar steady. Not by avoiding all carbohydrates, but by choosing ones that don't cause spikes. Vegetables, legumes, whole intact grains, some fruits. These release their energy slowly. White bread, white rice, pastries, sugary drinks. They send your blood sugar soaring, then crashing. And every spike damages that protective layer a little more. You also need the building blocks to repair that coating. Certain compounds from seaweed have shown promise in research. And colorful vegetables, berries, dark leafy greens, these contain natural compounds that protect against oxidative damage. One gentleman I worked with, Thomas, was 70 years old. His blood pressure was controlled with medications, but tests showed his vessel lining was inflamed. We simplified his diet, focusing on steady blood sugar and lots of colorful vegetables. Added a seaweed-derived supplement. 3 months later, we tested again. His vessels were functioning better. His blood pressure had dropped enough that we could reduce one medication. 6 months after that, both medications were gone and his numbers stayed healthy. 2. Addressing calcium buildup. Now let's talk about that calcium in your arteries. Many people think once it's there, it's permanent, but that's not entirely true. There's a protein in your body called MGP. Think of it as a traffic director for calcium. It tells calcium where to go, into your bones, not into your arteries. But this protein needs activation, and it's activated by vitamin K2, not K1, which helps your blood clot. K2 specifically. Without enough K2, calcium wanders into your arteries and stays there. With adequate K2, it gets redirected back out and into your bones where it belongs. You'd need to eat fermented soybeans daily to get enough K2 from food, so for most people, a supplement makes sense. But K2 works best with partners, vitamin D to help calcium enter your bones, and magnesium to prevent it from crystallizing in your vessels. Most of us don't get enough magnesium from our modern diets. It's found in dark leafy greens, nuts, seeds, whole grains, things we often don't eat enough of. And stress, alcohol, certain medications, they all deplete magnesium further. I worked with a woman named Margaret, 73 years old, who had severe calcium buildup in her main artery. We started her on K2, vitamin D, and magnesium, while also improving her diet. 6 months later, her calcium score had actually decreased by 8%. A year later, it was down 15%. Her blood pressure improved so much we were able to reduce her medication significantly. Supporting nitric oxide production. There's a gas your vessel lining produces called nitric oxide. It's one of the most important substances for keeping your blood pressure healthy. When it's released, it tells your vessels to relax and open up. Blood flows more easily. Pressure drops. But when that protective lining is damaged, nitric oxide production falls. Your vessels stay constricted. Pressure stays elevated. The good news is you can boost nitric oxide naturally. Exercise does it by increasing blood flow, which stimulates production. But there's a specific type of exercise that's particularly effective: sustained hand grip exercises. It sounds simple, almost too simple, but research shows that squeezing a hand grip device at moderate intensity for a few minutes, several times, done regularly, can lower blood pressure as effectively as some medications. It works by creating bursts of blood flow that stimulate your vessels to produce more nitric oxide. There's also something remarkably simple you can do. Breathe through your nose instead of your mouth. Your nasal passages actually produce nitric oxide, and breathing through your nose carries it into your bloodstream. Some people who switch to nasal breathing, especially during exercise and sleep, see notable improvements in their blood pressure. Certain nutrients support this process too. Folate from leafy greens, vitamin C from fruits and vegetables, vitamin E from nuts. These help keep your nitric oxide production working properly. 4. The insulin reset. Finally, let's address that insulin issue. The most effective way to lower insulin is to give your body regular breaks from eating. Not starvation or extreme fasting, just condensing your meals into a smaller window each day. For example, eating all your meals between noon and 8 p.m., then having nothing but water, black coffee, or plain tea until noon the next day. That gives you 16 hours without food, during which your insulin drops to baseline. Your kidneys unlock. They start excreting sodium normally again. Your blood volume normalizes, your pressure comes down. Research shows this approach can lower blood pressure by 10 to 12 points within 2 months, just from changing when you eat, not necessarily what you eat. The other piece is making your cells more responsive to insulin through resistance exercise. Lifting weights, even light ones, 2 or 3 times a week helps your muscles become more sensitive to insulin. Your body doesn't need to produce as much. Your baseline insulin drops. Small additions help too. A teaspoon of apple cider vinegar before meals slows carbohydrate digestion and reduces insulin spikes. Cinnamon improves how your cells respond to insulin. Berries contain compounds that support healthy insulin signaling. I remember Robert, 68 years old, whose insulin levels were nearly double what they should be. We implemented time-restricted eating, added resistance training 3 times weekly, and included vinegar before meals and cinnamon in his coffee. 8 weeks later, his insulin had dropped significantly. His blood pressure improved enough to reduce medication. 4 months later, both medications were eliminated. 2 years on, his numbers remain healthy without any medication. I know this probably feels like a lot of information, 4 different approaches, various changes to consider. But here's what I want you to understand. You don't have to do everything at once. Start with one thing. Maybe it's stabilizing your blood sugar by choosing different carbohydrates. Maybe it's trying that 16-hour eating window. Maybe it's adding some simple hand grip exercises to your day. Small changes compound over time. And unlike medications that just manage numbers, these approaches address what's actually causing the problem in the first place. Now, I need to be clear about something important. I'm not suggesting you stop your blood pressure medications. That could be dangerous and should never be done without medical supervision. What I am suggesting is that you add these supportive approaches while continuing your current treatment. Monitor your numbers carefully, and as they improve, work with your doctor to adjust medications gradually and safely. Many doctors don't know how to reverse vascular damage because they've never been taught these approaches. They only know how to manage pressure with medications. But that doesn't mean the damage is irreversible. It just means you need to take an active role in your own healing. Your body has a remarkable ability to heal when given the right support. Even past 60, 70, or 80, your vessels can become more flexible. That protective lining can repair itself. Your blood pressure can normalize naturally. I've seen it happen countless times. People who were told they'd be on medications for life, gradually reducing them, sometimes eliminating them entirely, while their numbers stay healthy and their vessels grow stronger. It's not about turning back the clock or denying that you're aging. It's about supporting your body's natural healing capacity, about addressing causes rather than just managing symptoms. You deserve to understand what's really happening in your body. You deserve options beyond just taking more pills or higher doses. And you deserve hope that things can actually improve, not just be maintained. If you found this helpful, I'd be grateful if you'd subscribe to this channel. I share information like this regularly because I believe you have the right to understand your own health, and I'd love to hear from you. What resonates with what you've been experiencing? What questions do you still have? Your insights help me understand what's most useful to talk about. Take care of yourself, listen to your body, and remember, your health journey isn't over. Sometimes it's just beginning in a new way with new understanding and new possibilities. Until next time, I'm Dr. Naira, reminding you that your body is still capable of remarkable things when you give it what it needs.